I'm really passionate about bowel care in patients who have nerve illnesses. I think this is a real Cinderella area which doctors and nurses have ignored for a long time, and there is a lot we can do. We've ignored it, I think, because we haven't felt that there's much we can do or it's much of a problem. What we've ignored is the fact that you, our patients, have told us, actually this really blights my quality of life. It stops me being able to go out, to be able to eat normally, to be able to function normally. It gives me infections, it makes me feel slowed up. And there is tons we can do. What's really important is not to accept this is as good as it can be unless you've been told that's as good as it can be. What's really important is to always start off with diet and simple lifestyle type things. That does make a difference to some people, and it can be all they need. But sometimes, quite often in fact, people will need more. They'll need sometimes to use laxatives or antidiarrheal drugs. But that isn't the whole story for most people either. And what's attractive is that we don't have to stop and accept that as being the best we can do. We can go further than that now, and one of the things that's exciting for us is the introduction of transanal irrigation. This is a system whereby patients can use a catheter, a single-use catheter, into their bowel to essentially wash out the bowel, and do that every couple of days often because it clears out so much of the bowel effectively. And by doing that, we see in responsive patients really good outcomes in terms of quality of life, reduction of infections, less time being spent in the toilet, no or reduced chances of incontinent episodes, and this is a big deal. And that fits in a sequence of therapies. Sometimes patients just need the lifestyle stuff, sometimes they need laxatives, sometimes they need antidiarrheals, sometimes they need irrigation. And even if in those patients in whom irrigation fails, there are other further options. There are things which are more complex and intrusive that we can do. And as I reinforce that message, it's important not to say, this is as good as it's going to be as a patient. Only accept where you are now if you've been told that's as much as we can do, because there's always something we can try and do to improve quality of life with bowel care.